Pneumonia, causes and symptoms. Pneumonia is an infection of the lungs with a range of possible causes. It can be a serious and life-threatening disease. It normally starts with a bacterial, viral, or fungal infection. The lungs become inflamed, and the tiny air sacs or alveoli inside the lungs fill up with fluid. Pneumonia can occur in young and healthy people, but it is most dangerous for older adults, infants, and people with other diseases, and those with impaired immune system. In the United States, around 1 million people are treated in the hospital for pneumonia each year, and around 50,000 die from the disease. Symptoms. The first symptoms of pneumonia usually resemble those of a cold or flu. The person then develops a high fever, chills, and cough with sputum. Common symptoms include cough, rusty or green phlegm or sputum, curved up from lungs, fever, fast breathing and shortness of breath, shaking chills, chest pain that usually worsens when taking a deep breath, known as pleuritic pain, first heartbeat, fatigue and weakness, nausea and vomiting, diarrhea, sweating, headache, muscle pain, confusion or delirium, especially in older adults, dusky or purplish skin color or cyanosis from poorly oxygenated blood. Symptoms can vary depending on other underlying conditions and the type of pneumonia. Causes. Bacteria and viruses are the main causes of pneumonia. Pneumonia causing germs can settle in the alveoli and multiply after a person breathes them in. Pneumonia can be contagious. The bacteria and viruses that cause pneumonia are usually inhaled. They can be passed on through coughing and sneezing, or spread onto shared objects through touch. The body sends white blood cells to attack the infection. This is why the air sacs become inflamed. The bacteria and viruses fill the lung sacs with fluids and pus, causing pneumonia. Risk factors. Those most at risk include people who are aged under 5 years and over 65 years, smoke tobacco, consume large amounts of alcohol or both, have underlying conditions such as cystic fibrosis, chronic obstructive pulmonary disorder or COPD, asthma, or conditions that affect the kidneys, heart, or liver, have a weakened or impaired immune system due, for example, to AIDS, HIV, or cancer, take medicines for gastroesophageal reflux disease or GERD, have recently recovered from a cold or influenza infection, experience malnutrition, have been recently hospitalized in an intensive care unit, have been exposed to certain chemicals or pollutants. Types. There are different types of pneumonia depending on their cause. Bacterial pneumonia. The most common cause is the bacterium Streptococcus pneumoniae, but many different bacteria can cause pneumonia. Viral pneumonia. This can result from the respiratory syncytial virus or RSV and influenza types A and B, known as the flu. Aspiration pneumonia. This can happen when a person breathes food, liquids or stomach contents into the lungs. This type is not contagious. Fungal pneumonia. This can result from a condition such as valley fever caused by the coccidioides fungus. Hospital-acquired pneumonia. This can occur in patients being treated for other conditions, for example, those attached to a respirator or breathing machine. Regardless of the cause, the signs and symptoms will be similar. Prevention. There are two different vaccines to prevent pneumococcal disease, the most common bacterial cause of pneumonia. These cover a wide variety of pneumococcal infections and are recommended for both children and adults, depending on their health conditions. Pneumococcal conjugate vaccine or Prevnar. Pneumococcal polysaccharide vaccine or Pneumovax. Prevnar or PCV13 is normally included as part of an infant's routine immunization. It is recommended for children under 2 years, adults over 65 years, and those between the ages of 2 and 64 years with certain medical conditions. Pneumovax or PPSV23 is recommended for children and adults who are at increased risk of developing pneumococcal infections. This includes adults aged 65 years or older, people with diabetes, those with chronic heart, lung or kidney disease, people who consume large amounts of alcohol or who smoke, those without a spleen. Those aged between 2 and 64 years with certain other medical conditions may be advised to have this vaccine. The vaccine may not completely protect older adults from pneumonia, but it can significantly reduce the risk of developing pneumonia and other infections, including blood and brain infections. Along with vaccinations, physicians recommend regular hand washing, covering the mouth and nose when coughing and sneezing, refraining from smoking, eating healthfully, exercising 5 days a week, staying away from the sputum or cough particles of others with pneumonia. Most people recover from pneumonia in 1 to 3 weeks. Those at risk of severe symptoms should ensure they keep up their vaccinations. Diagnosis. A doctor will ask about symptoms and medical history and will carry out a physical examination. They may suspect pneumonia if they hear coarse breathing, wheezing, crackling, or decreased breath sounds when listening to the chest through a stethoscope. The doctor may also check the oxygen levels in the blood with a painless monitor on the finger called a pulse oximeter. Chest X-rays can confirm a pneumonia diagnosis and show which areas of the lungs are affected. A CT scan of the chest may provide more detailed information. Blood tests measure the white blood cell count. This helps determine how severe the infection is and whether a bacteria, virus or fungus is the likely cause. Blood culture may reveal whether the microorganism from the lungs has spread into the bloodstream. An arterial blood gas or ABG blood test may provide a more accurate reading of the body's oxygen and carbon dioxide levels and other factors. A sputum analysis can determine which organism is causing the pneumonia. A bronchoscopy is sometimes used for further investigation. A thin, flexible and lighted tube called a bronchoscope is passed down into the lungs. This enables the doctor to examine directly the infected parts of the airways and lungs. The patient is under anesthetic.